Welcome to the Turd Nerds. We are the functional gastroenterology podcast discussing all things poop. Before we take the plunge into today's episode, let us tell you a bit about ourselves. I'm Dr. Rebecca Sand, a naturopathic physician and acupuncturist, and I specialize in all things gastroenterology, hormones, and fertility.
I'm Dr. Ami Kapadia, and I'm a medical doctor trained in family medicine and functional medicine with a special interest in gastrointestinal health, food and environmental allergies, and autoimmune disease.
And I'm Dr. Ilana Gurevich, a naturopathic physician and acupuncturist who is board certified in naturopathic gastroenterology. I specialize in inflammatory bowel disease, IBS, and other functional digestive disorders. Let's jump into today's episode.
The following discussion is for educational purposes only and not intended to diagnose or treat any diseases or conditions. Please consult your doctor before incorporating any of this information into your care. The information presented on this podcast is not medical advice.
Hi, Turds. We are very, very excited to bring you part 2 of Parasites.
Yay.
Before we jump into it, though, what I want to do is I kind of want to give one more shout out. You know, the Turd Nerds have been sitting here together in a closet for 2 years plus by the time this
Sometimes
episode.
we leave the closet, but
Not really.
Rare do love
Yeah.
gathering.
Yeah.
So yeah, sometimes we have an occasional dinner meeting, but we've been sitting here for 2 years, just really trying to get this Turd Nerd mission out to the world.
Mm-hmm.
And the easiest way for us to connect to people and let them know about this different way of viewing GI health is really through you guys helping us by giving us ratings and reviews. It doesn't take a second. You don't really need to write anything. We just, the 5-star ratings and reviews really helps other people find us.
It might take a second.
Maybe
it's a really worthwhile second.
Maybe less than a minute.
We appreciate it. We love supporting this mission, and we love getting better information out there about like how to think differently about medicine. It truly is a passion. We have so much fun with this, and we have grown so much. We love you guys, and if you can, just take a minute, rate us, review us.
Rate, review, and subscribe. If you're
And
listening,
subscribe,
you
yes.
have no excuse. Rate, review, and subscribe.
Yeah, and we love reading what you guys write.
And that actually does give us ideas for future episodes.
It totally does.
So if
We
there's
read 'em.
something that you want us to talk about,
Yep.
give us a message, rate us, review us, help us spread the Turd Nerd
It
word.
doesn't have to be health related. We can go off topic. I'm very bad at pop culture and such, but other
Yeah,
topics.
I'm into it. Yep.
I mean, I've got like no skills, guys. Just really
Ilana
naturopathic
focuses
gastroenterology.
on this one area for most of her spare time.
Uh,
Okay.
So let's jump back into where we left off, which
Yeah.
is parasites and protozoa. We talked about testing, we talked about presentation, we
the
talked
different types,
the
of
different
parasites
types,
and
what we need to
protozoa.
worry
Yeah.
about. Let's dive into what everybody is actually wondering about,
Mhm.
which is how to treat.
Mhm.
So let's start first by talking about pharmaceutical interventions,
Okay.
and second about talking about natural or herbal interventions, which is I think what our audience is looking for.
Yeah.
So how did we start preparing for this episode? All of us got onto our different medical software and tried to see what does standard of care tell us to do.
Yep.
I have in front of me up to date, Dr. Sand has Hippocrates and Dr. Kapadia has an American Family Medicine article.
Correct.
So why don't I jump in? What does up to date tell us? How does it tell us to treat different protozoa? For Giardia, the recommendation on up to date is using metronidazole, nitinoxanide, tinidazole, which are 3 that I think
You pick one of those generally, not all of
Yeah.
them.
Yeah.
And then they list 2
I
other
don't think
ones.
there'd be anything left.
Yeah. They list 2 other ones that I've never utilized called furazolidone
Never used it.
Yeah, I mean,
and quinacrine.
Never used it.
Nope.
Also, I might be butchering it.
probably.
What do you guys have for treating amoebas?
Well, I use nitazoxanide. I like that one. I think it's FDA approved for Giardia and crypto at this point. There is some data on it supporting H. pylori treatment in conjunction with other things.
There is data for bacterial overgrowth as well.
Totally. So I think especially in those people that you're like, they have the crypto, they have the Giardia or something, but I'm suspicious of a lot of other things going on, other greater dysbioses. I think nitazoxanide.
But it can aggravate yeast in some people is the
Yeah.
only thing. So I would sometimes go to tinidazole first. I think all of us prefer not to use metronidazole unless there's no other option for the patient. So I would generally pick tinidazole or nitazoxanide for Giardia and cryptosporidium.
So metronidazole and tinidazole are the same class.
They're related. I don't know the details of why tinidazole clinically seems to be much better tolerated, even though they're in the same class.
Yeah, metronidazole is a bomb.
So one of the big differences between tinidazole and metronidazole is length of treatment course.
Yep.
So for tinidazole, it's a 3-day course. 2,000 milligrams once a day for 3 days.
Yep.
For metronidazole, it's a 7 to 10-day course. And that, I think, is one of the big differences.
Mm-hmm.
The other difference that I know of is metronidazole is used for everything. Like, if you don't know what's wrong, then they're going to give you metronidazole.
Mm-hmm.
And I think it is pretty grossly overutilized.
It probably works, but it may be overkill in a lot of cases, and patients don't like it. Like, it's not tolerated very well, a lot of side effects.
And that's not even beginning to talk about, DNA transmission from different species that develop tolerance or become resistant.
Yeah.
And so that causes a problem. Nitinoxanide, I don't think it's overused. Nitinoxanide also personally for me happens to, so there's like maybe 5 or 6 drugs that I consider naturopathic drugs.
Yeah, we've claimed them.
Right. And nitinoxanide is one of them. So the nitinoxanide, what does that look like for a patient? When you go on Hippocrates and you look at the side effects of nitinoxanide.
Right. It's very minimal.
So
nothing.
Serious side effects?
Right. For the serious side effects.
Serious side effects said none known but might occur. Right.
Yeah.
So they don't have a single, and this is not a new drug.
Yep.
Literally does not have a serious side.
It's true.
Yeah.
Whereas metronidazole and potentially tinidazole have a black box warning as being carcinogenic.
That sucks.
Yeah. And it's like, I'm pretty sure it's rat studies and used, long term, but still, it's not nothing.
It's not nothing.
Yeah.
So then the common side effects for nitinoxanide, also known as Alinea, brand Alinea, is abdominal pain, urinary discoloration.
Yellow eyeballs.
Let's clarify that in a minute. Abdominal pain, urinary discoloration, headaches, nausea, and diarrhea.
Yeah.
And I tell my patients, I'm going to expect you to feel all 5 of those.
Yeah.
Like, it's not going to be serious. I'm not doing any long-term harm,
Even
but you're
for
going to
just
feel
like
bad.
A 3-day course?
My answer is I like to tell everybody that it's going to be bad.
Worst. Yep.
Because then A, I don't get the phone calls.
Yep.
And B, it is like they're expecting. And so if it doesn't go that way, then they're like, oh, that was great. I had no issues.
Yep.
The other thing so the urinary discoloration, it's not just urinary discoloration. Also, I have patients who, when they wear contacts,
secretions, yeah,
all their secretions will turn yellow.
Yeah.
It's not jaundice. It's just the drug absorption.
Yep.
Good to
but
know.
Weird.
Yes.
I've totally seen it happen.
And so then when we're talking about 4GRD in particular, the dosing is the other big conversation where people don't necessarily agree.
Mm-hmm.
So we have what's recommended for dosing, which is, I think, a 3-day course. And then we have what some of us...
That's generally what insurance will cover, is a 3-day course.
Very good point, actually. Very good point.
Otherwise, it's out of pocket or compounded.
It did recently go generic.
Mm-hmm.
So nitinoxanide is now available generic.
Yep.
Does that make it cheaper? No, it did not make it cheaper.
Yep.
Interesting.
And so what I often will do is I will utilize our compounding pharmacies, like my local compounding pharmacy of choice. I'm getting a 21-day course for like $180.
Yeah, not bad.
And then we know that we're getting the right drug, because with some of the generics, there's been some questionable issues with contamination and this or that. So,
and then the other thing about getting a compounded medication is all you're getting is the drug. There's no excipients.
Right,
and
for reactions.
Excipients can make a big difference.
Yeah. So I think the FDA approved duration for Crypto and Giardia is 3 days, the 500 milligrams twice a day. For H. pylori, which is an off-label use, it's a 7 to 10 day course.
So then let me just quickly, I know we started with Giardia. The other place where I am using nitinoxanide is with Blastocystis homini.
Right.
I personally, in my clinical practice, have not seen efficacy of anything short of 21 days on nitinoxanide. So I am using a 21 to 30-day course of 500 milligrams twice a day.
Yeah, it's a lot.
It's a lot.
What do you add in to help people out with that?
Not
Water.
much.
Drink water.
Yeah, not much.
Yeah.
I mean, and in my experience, when I'm using these longer courses, it's not like they are feeling bad the whole time, but the feeling bad will come in waves. Mm-hmm. But at least I'm not worried that I'm doing harm.
Yep.
And if we're honest, if I'm putting them on this, most of them have not been feeling good for a long time.
Yeah, there's hope then.
Right. So that's how I'm using nitinoxanide.
Yeah, I had used those longer courses for a while, and then I switched to doing 3 days then herbals, then another 3 days of the
Yeah.
nitazoxanide, because the blastocystis takes more. But I did not love doing those super long protocols with people. We have no data on the comparative efficacy of doing either of those protocols.
That is
so.
very true.
Yeah.
That is super true. There is no data on this.
Yeah.
Nobody's really looking.
Yeah,
And so what we have is anecdotal information, and that sometimes it's useful and sometimes it's BS.
right.
Yeah. So that's Giardia, right? And that's also
And
nitinoxanide
cryptosporidium.
and crypto. Let's talk about how we use tinidazole. Because that's it. Tyndall Max is the brand. Tinidazole is the generic. That's also a big one that I feel not
Yeah.
as comfortable with, but more comfortable with.
I mean, it has good data for Giardia. When I had reviewed things, it was pretty equal cure rates for Giardia using tinidazole. And a lot of the studies were just on one dose. I was still doing 3 days of that just because our patients had chronic things going on. But there was like 90% efficacy of clearance of Giardia with one dose.
Yeah.
So when I am using tinidazole, I do believe there is anecdotal information that talks about the life cycle of parasites and protozoa, right?
Oh, I'm so ready for this.
Yeah,
I know where
they
you're
go.
going.
Yeah, you do. Dr. Sam's been with me a long time. They go through an egg hatching stage and then and parasite stage. So personally, one of the reasons why I dose nitinoxanide longer, and one of the reasons I dose tinidazole the way I do, is because I'm trying to cover both the egg and the hatching state.
Yep.
So I will dose it around the full and the new moon.
Which I definitely do that sometimes, but I tell patients this is going to make me sound a lot more woo-woo than I am. Just bear with me. There is a little bit of science behind this.
I mean, it might go over better if you tell people it's based on the life cycle of the organism rather than some type of unusual.
We're already fringe, and then when we start to tell people to take their herbs around the new moon and I mean, it's just like you can see people just be like, "Oh shoot, where am I?" You know.
I once had a patient who was like, "I hate it when naturopaths act like naturopaths," and I was like, "That's me.
Same.
Like I am telling you." But that being said, the other story that I have with this, which I'm sure I have told on the podcast, is my dad, who's a psychiatrist, will always say, "Oh, Ilana, the full moon is coming. Everybody who is a little crazy goes very crazy."
I mean, that is true. He's not wrong.
It is a thing.
I mean, yeah.
Me included.
All right.
So
I try to not bring this part up.
we work in different settings. So what I generally do with my dosing strategy is I will dose the day before, the day of, and the day after the new moon, and repeat 2 weeks later for the full moon. My 21-day course of nitinoxanide, I'm getting both of those covered as well. By the nature of dosing for 21 days, I'm getting both of them covered.
Yep.
And so 2,000 milligrams once a day for 3 days, repeat about 2-ish weeks later. So that's, and I will use that protocol for Giardia if I can't get nitinoxanide, because let's be honest, tinidazole will be much better covered with insurance than nitinoxanide. I will also use it for any kind of amoeba disorders, and I will also sometimes use it for blastocystis homini, but not as reliably as I'll use nitinoxanide.
What about paromomycin?
Yeah, that one I have to try to remember if that was for Dientamoeba fragilis, is from my memory of last using it, but I would have to look it up.
Based on the article that you have on your website, Dr. Kapadia, it is absolutely for Dientamoeba fragilis.
Okay. So that was like a miracle cure anecdotally for one of my patients who had gone round and around with GI symptoms forever with providers. Again, this is from memory. Don't quote me on it. I believe it's a non-absorbed and acts primarily in the GI tract. I can't verify that except by my memory from last prescribing it like 3 years ago. So we'd have to confirm that. I didn't use it a ton, but that was the main organism I would use it for.
So I'm seeing for that one that you dose based on weight.
Yes.
Which does
I
require
feel
a
like
little math.
I feel like that might be what they always write, but they have a certain limit of dosages that are available.
It comes in 250 milligram caps.
I think we would do 500 TID.
I feel like I might even do 750 BID.
Yeah. I mean, get it in. Take it with food.
Yeah, and that one's an interesting one because sometimes the pharmacies don't necessarily, like I've had pharmacies not have it in stock.
Right. I've had that happen too. There was a period of time. I don't know what the availability is of it now.
So, for intestinal amoebas, the dose is 25 to 35 milligrams per kilogram in divided doses 3 times a day for 5 to 10 days.
Yep.
And then they will also use it, for hepatic encephalopathy, because really they'll try anything for that.
Yep.
So that's paramomycin. The other one is palmopalmitate.
Parental palmoate.
That's it. Yeah.
I think that's been used for pinworm and probably other
And that's an
things
OTC,
as well.
right? That's Reese's pinworm medication. Are those the main drugs you guys are using before I jump into discussing Simon U?
I think so.
Should we just give like a list of the basic antiparasitic herbs?
No, because I'm not done with drugs yet.
Okay.
So one of the things we kind of negotiated talking about is I did want to talk about Simon Yu's protocol. Okay. The reason I wanted to talk about it is because Simon Yu is a very big name, especially in the parasitology world, and he uses a big protocol that he then taught to Dietrich Klinhart, that Dietrich Klinhart has been teaching. So a lot of these Lyme docs, chronic disease docs, are using this protocol. And the other thing that is nice about this protocol is it literally is the who's who of every single pharmaceutical we're using for treatment. So Simon Yu is this really interesting medical doctor who practices in, I think, St. Louis, Missouri, maybe. Does that sound right? Yeah. Ami and I went to a training that he offered years and years ago. And what he does, he came up with this. He was a physician in the military who did a rotation somewhere in Latin America. And he was a physician, so he worked as a doctor for the military. And so he was pretty deep in Latin America, in very rural areas. And they were using a lot of these anti-parasitic medications. And he was seeing a reversal of pretty significant chronic disease going after the parasites. Then he started looking and he's like, well, turns out that the minute we started treating horses preventatively for parasites, protozoa, and worms, we literally doubled their lifespan.
Wow.
And that's a known fact. Like horses used to only live until they were like 15 to 20. And then we started giving them preventative anti-parasitic treatments yearly. And they literally will now live 40 years. Just by treating parasites.
Yeah.
And so he came up with this protocol. I mean, it's pretty interesting.
Yeah.
He came up with this protocol. And the protocol, I'm going to give you a list. And sometimes he uses all of these. So ivermectin, tinidazole, nitinoxanide, albendazole, praziquantel, levamisole, and then antifungals.
So these are all off-label uses that are generally not used in general in
medicine,
routine medical care.
Yet why did he pick these ones?
Because he was dealing with a lot of very sick chronic cancer patients, very sick chronic Lyme patients. Like he had like the sickest of the sick population. And his whole thing was like, I used to treat just one at a time. And then I started seeing these patients and they're getting sicker. And when I did the whole kit and caboodle, that was the only time I could break their disease and get them healthy again. And then Dr. Klinhart also talks about this, and he also was using this for his most chronic of chronic patients.
So no herbs, just
that's Simon Yu does not feel comfortable with herbs. He's a conventionally trained medical doctor. That's just not what he does.
Yep.
This is what he does. Yep. And so I do think this protocol is out there, and so it's important to talk about it. However, so that's the drugs.
This is not standard of care in any conventional, functional, or naturopathic medical teachings.
Unless you're treating Lyme.
It's his protocol.
Right. And I do not use this. I will use these drugs individually, but I'm not dealing with these chronically ill people. Right. Like my people are ill in a different way. And, I can argue in some ways it's a little bit easier for me to get to where I need them to go because I'm dealing with their GI tract. Whatever I put in there, especially if I do some biofilm provocation, I'm going to be able to get. Like I'm not going to the kidneys. I'm not going to the heart. I'm not going to the brain. So my job is a little bit easier. So I'm not using this protocol, but it is out there.
Yeah.
So that's what it is. Okay, so then that brings us to, do we have to use pharmaceuticals or do we have herbal options? And the answer is yes, we have herbal options. We're going to talk. We're going to talk about them.
Yeah.
My efficacy with them is quite mixed.
Well, I think it depends again on what you're treating and who the person is. So again, if they have like a frank issue of a parasite protozoa that needs the drugs, you need the drugs. But if this is something that's been kind of going on, it's not one of the big serious ones, it's maybe one of those more gray ones that we can have some room with. And they also have SIBO and they also have like general dysbiosis and other things. And or maybe they don't tolerate the big drugs or they don't want to start there, which we get a lot of those patients too who rightfully so are afraid of pharmaceuticals. Some of our herbs that are considered anti-parasitic, black walnut, a lot of our essential oils. So I see them use a lot of these herbs and essential oils. Golden seal, gentian, some citrus seeds, neem, of course, the berberine, the coptis, all of those, artemisia, wormwood,
Jamaican dogwood,
badanga,
oregano. Yeah. So I think those, I mean, any others that we can think of?
I use the two that I think of the most.
Yeah.
Are wormwood and black walnut.
Yep.
And maybe artemisia.
Yeah.
Those are the two. Those are my heavy hitters.
Yep. And they are heavy hitting. Like they're intense herbs. They taste awful, especially artemisia.
Any that we're missing?
Yeah.
So let's go. What's the terrain? Like a patient is listening to this episode. They have a parasitic infection. Yep. They don't want to try the drugs, or they can't find a doctor to write that prescription. Yep. They're going to end up doing one of these anti-parasitic protocols. Yeah. They are. What have we seen?
Well, I think first, if you have access to broader testing, to figure out as best you can what the landscape is. Like, just get some data on the table on what you're treating as best you can, because that will guide what we do next. But if you just have are you just saying, like, if you have a suspicion you have a parasite?
Yeah, you're on the internet, you're listening to this, you live somewhere in Podunk someplace, right? Podunk, Australia, Podunk, America, Podunk, UK. This is our audience, you know?
Lack of access.
What are you going to do? What are you going to find? Yeah. How are you going to navigate this?
I mean, the best you can sort of boost your immune defenses before you start taking something antimicrobial will help, as long as you're, it depends where you are. Like, if you can't, some people just, their diet has become so limited, but if you can improve the quality of your diet ahead of time, make sure you're drinking enough water, get off of alcohol, just try to improve your general state of health. You'll respond better.
Wait. So what you're saying is, if you start living like a human instead of a robot,
you will respond better to any treatment that you do.
And you're addressing the terrain again, back to that.
Right.
Like the landscape, you can blast things all day with anti-parasitic herbs, but if you're not doing anything to heal the environment, they're just going to come right on back, which is true for pretty much everything we talk about on this podcast. But yeah, that's definitely not a bad place to start. And I would even argue the really, really restrictive diets people are on to manage symptoms, like you've got to find a way to broaden that, to get the diverse fibers in, to get your good bugs in a healthy, diverse population, or you're never going to be able to tackle this stuff. Like, that has to be part of it.
Yep, I would agree.
So, and then I would also say essential oils should not be ingested. Like, you can get food grade quality ones, but there are a lot of bogus products out there. You shouldn't eat essential oils. Like, they're neurotoxins. They can really damage tissue. They are potent.
They're
potent
caustic.
Medicine. Yes. And there are products, like I give them in pills, but they are food grade,
like oil of oregano, peppermint
lavender essential oil, like that kind of stuff. But I think it's a big caution with the antiparasitic treatments. Again, there is very limited FDA regulation on products in this country.
For better or worse.
For better or for worse, so be careful, especially with this realm of herbs.
I think that one of the places where I have comfort in this is if it's a bigger company that's owned by a multinational
pharmaceutical company.
Kind of, yes. I am like, dude, these guys have so much damn liability. Yeah. Like, they are testing their products to a higher standard than some random supplement I pick up that has a beautiful website with no information. Yeah. The more that I've noticed that the prettier the website, the less I can find what's actually in there.
Label.
Yeah.
Yeah, exactly. And they have like a big Instagram campaign, and like it's probably full of sawdust.
Right. Best. Exactly. At best. So I personally utilize a lot of these bigger companies that have financial backing, because I think that their liability is so much higher risk that they're not going to end up, they're going to be testing and third-party testing. Mm-hmm. So I agree with you. That is my standard with using essential oils. Mm-hmm. I have seen patients come in and they're like, I think I have a parasite, so I'm doing this parasite protocol, blah, blah, blah. It involves Jamaican dogwood and wormwood and black walnut and blah, blah, blah.
Yeah, and they feel terrible.
They feel terrible. They feel terrible.
Well, they might have been on it for like 2 years.
Yeah. But I have seen people, some people don't tolerate these protocols.
Aren't we worried about their liver? I mean, these herbs are a little rough on the liver.
I have seen that.
Yeah.
With artemisia.
With artemisia nin. I've never seen it with artemisia. Yeah. But I've seen it with artemisia nin.
Right.
Yeah, it totally happens with herbal supplements, because some of them do that. but also the sourcing of herbal supplements. If it's not a good, reliable source, again, back to like regulation in this country, there's heavy metal contamination, there are toxins, there are like just products that shouldn't belong in there altogether.
There are also exclusively using active constituents and not whole plants.
Right.
Like, I think I told you guys, I was talking at a lecture with Eric Yarnell, who's an herbalist out of Seattle, incredible, very gifted naturopath, very gifted herbalist, has an herb company that I trust very much, actually.
Very smart.
And he was like, if you're using something like artemisinin, which is the active component, the quote unquote active component,
it's like the drug form.
Right. That's a drug. That's not an herb, because you don't have any of the other trillion active components that are used to make that active component less toxic.
Yeah.
Now you're just giving them an alkaloid.
Synergistic, which we all learned in school. Like the whole herb has properties. Like the more we standardize it, that's a very Western medicine approach to herbal medicine. We can like base drugs and stuff off that, but let's be clear, they're drugs then. They're not the beauty of herbal medicine and how our bodies have really evolved to work with plants.
So we should maybe check LFTs more frequently if someone's going to stay on herbals for a long time.
So that is now, I have a basic panel that I run for everybody that involves a comp metabolic. And if I am putting them on any of these alkaloid containing herbs that have potential to do this, I am rerunning LFTs every 3 months.
And I'm also having a pretty serious discussion with them about liver health in general. Like, you don't get to be on alcohol while we're doing this. Like, you just
That's great.
Don't, for your gut, but for your liver as well. And all the other toxicants, the more we can reduce, just to let the body try to do its thing.
I am now asking every single person what they clean their house with.
Oh, that's awful.
Yeah.
Have you extended your visits to like
7.5 hours?
79 minutes?
Every visit is 7.5 hours. It's a long day.
Because you're asking them their meals.
Yeah, always.
But
and I can still do this in 30 minutes.
But toxicant exposure, I mean, from a hormone perspective, because I do a lot of that, like we have induced PCOS with food and environmental toxicants. Like we have studies on that. So yeah, I mean,
and that's not even talking about infertility, which PCOS is the underlying cause,
diabetogens,
or increased hormone-based cancers.
Obesogens.
Yep, plastics alone.
And people will say that the dose matters and there's not that much, but there's studies on very minimal exposure causing, like our day-to-day exposure causing these problems.
Oh, I mean,
what is it? What is that phrase? The poison is in the dose. I forget. It's not always. It doesn't have to be a super high dose to get the effects.
The other piece of that,
you're getting a big dose.
But the other piece of that is you're also getting a lot, like 1,000 little doses.
Yeah.
This plant is wrapped in plastic. This can is coated in plastic. This is in our air.
These bisphenols everywhere.
It does make me just want to give up and go to sleep. Yeah. But also it makes me want to stand up and keep fighting.
Europe.
I mean, Europe has a problem, but they don't have this problem. It's a different problem.
Better regulations in their agriculture, and we could talk about that all day.
Yeah.
But anyway, it does impact the gut, as it turns out.
Okay, so these protocols are available, and sometimes they work, and sometimes they don't.
So I'm thinking of it more like, we get some data. They have a history of recurrent SIBO. And now all of a sudden, some like those low grade parasite protozoa type things are appearing maybe on testing. That's when I think the herbs.
Yes, I can see that.
Unless I'm like, it's a symptom of something greater. And or they're just, our delicate flower patients that we all see. I include myself in that camp, where the drugs might not be suitable at that time for them.
So there is this whole line of products that use super drop doses that are very, very powerful. It's like,
I like those. Yeah.
Are they anti-parasitic?
Well, there's two main companies that a lot of us would use, and they have products for everything, for detoxification, for particular microbes, and they have like a more of a synergistic effect. So I don't feel like we're blasting people, like keeping them on some of these whole herb, these single herb products for so long. So they make me less worried about staying on them for prolonged periods of time.
Yeah, these protocols are available, and depending on who you are, you might have efficacy from something like a drop dose to something like an herbal protocol to something like a pharmaceutical. And I think that we can say that parasites are definitely part of our equation that really conventional system is not looking at all. And some people are looking at it not enough, and some people are looking at it too much.
Way too much.
Right.
Way too much. I also want to give a shout out for prevention.
An ounce of prevention.
So for my patients, if they've sort of, I call it, if they've like graduated their treatment program, like we've gotten through the SIBO, we've gotten through the like whatever, they're in UC remission, like something, they're stable. I tell them that I'm very protective over their gut for a couple years, because that's what we know. Assuming things go well, that's going to be how long it is for their microbiome to really take hold again. I don't expect them to be symptomatic, but we need to be protective. So, our travel protocol episode, great one to listen to. Like, be careful with your guts, because if you were tipped to the point of a parasite protozoa, you are more likely to tip again in the future.
Word.
So we really got to watch out for those folks and protect when they travel, when they get exposed to things, if they need antibiotics.
When they're heavily stressed.
Yeah. When they go camping.
Just don't go camping.
No,
Just
you have
save
to.
us all.
Camping is so good for your nervous system.
It does bring us business. I mean,
it's so good. It's good for my nervous system. Can I
Yep.
just ask one more question, just out of the context of how you guys are treating? How much do you focus on detoxification as part of this treatment? Like what?
liver detox?
Just like detoxification in general.
I mean, I think because we talked about fiber in our last episode, if their diet is pretty good and they're eating enough fiber, I try to use that as sort of the detox part, as opposed to giving them another thing to take away from food in the middle of the day,
I mean, the world knows how I feel about psyllium husk, which sort of helps on all sorts
You,
of
are
levels.
you have
But
converted
it
me.
is a gentle binder,
Yeah.
to kind of help with the body processing. And if you're pooping, you're detoxifying.
Yeah.
So for sure, if people end up with like looser stool at the end of this protocol, or like we have to put them on a heavy drug, nitazoxanide or something, and then they do get some kind of bowel irregularity, I start there. Even if like the parasite's gone or whatever, I need them pooping like a champ to detoxify, to get it out, and to prevent recurrence.
And then exercise.
Yeah.
Yeah.
Bad.
I mean, we have to live like humans. The foundation is, remember, you have to live like a human.
Mhm.
That is getting good sleep. That is getting good movement, and that is eating good food.
Yep.
Those are the foundations. After you meet those three needs, you can hop on the capitalistic, hamster wheel, right? And keep on working. But if those three things are not happening, you are going to pay the price for that in your future.
Yeah.
Yeah, we know.
Okay.
On a positive note, see you next time.
It's all true.
Okay, great. Thanks, guys.
If you like this episode, please subscribe and don't forget to rate and review us to help spread the turd nerd word.
Thanks for joining us today. Stay tuned. We release episodes every 2 weeks.